everyone, I'm Alicia. I'm going to do a speech to you today about breast cancer. Now, I got these books to pass out, if you could just pass them around. I went to my local cancer center, and they gave me a couple of books for you guys. And I learned some stuff when I was there, so I'm going to teach it to you guys. The National Cancer Institute says that a mammogram is an x-ray picture of the breast. Doctors use a mammogram to detect early breast cancer in men and women. Regular mammograms are the best tools doctors have to find breast cancer early, sometimes up to 3 years before a lump can be felt. When their breast cancer is found early, men and women go on to live long and healthy lives. A woman and a man should have a mammogram every 2 years, after the age of 50 to the age of 74. You want to talk to your doctor and let them know of any changes or symptoms you're having with your breast, and if there's breast cancer runs in your family. Your doctor may recommend that you have a mammogram younger than the age of 50 and more often than usual. What to expect during a mammogram. You're going to stand in front of a special x-ray machine. Your technician will place your breast on a clear plastic plate. Another plate will be firmly pressed from above on your breast. The plates will flatten your breast while the x-ray is being taken. You will feel some pressure. Having a mammogram is definitely uncomfortable for men and women, and some can experience pain as well. It only takes a few moments, and then the pain will subside. On the day of the mammogram, make sure you don't wear any deodorant, powder, or perfume, because those can show up as white spots on the x-ray. Some women prefer to wear a top with a skirt or pants instead of a dress, because you will have to undress from the waist up for the mammogram. Men. Breast cancer can happen in men as well. Men can develop breast cancer. Every year, 2,000 men find out that they have developed breast cancer. Along with the mammograms, men can also have an ultrasound done of their breast to see if they have any presence of breast cancer. Finding breast cancer early with mammography has also meant that many more women and men being treated for breast cancer are able to keep their breast. When caught early, localized cancer can be removed without resulting of the breast removal itself, which is a mastectomy. Mammograms require a small doses of radiation. The risk of harm from the radiation exposure is extremely low, but repeated x-rays have the potential that can cause cancer. The benefits of mammography, however, nearly always outweigh the potential harm for the radiation exposure. Make sure you inform your doctor, your healthcare provider, and your x-ray technician if you could be pregnant, because the radiation will harm the developing fetus. The National Breast Cancer Foundation says that along with a mammogram, men and women should also do a breast self-exam. Now you can do those in the shower, in front of a mirror, and lying down. And then there's 3 techniques you can use: a circle, an up and down lines, and a wedge. And I have a little diagram right here that shows what they are. The circle is just you start up the nipple and you go around and circle until you get to your armpit, and make sure you do under your arm as well. The up and down lines is just what it means. You go up and down all the way across your nipple, your breast, and under your arm. And then the wedge, you want to metaphorically cut your breast into a pie. I like blueberry. We'll say blueberry pie. And you want to take each pie segment and examine that spot all the way around your pie and under your armpit until it's covered. 40% of diagnosed breast cancer are detected by women and men who feel a lump. So establishing a regular breast self-exam is very important. The risk factors for breast cancer are age. The higher your age is, the more of a chance that you can have breast cancer. Family health history. If your father, mother, sister, or daughter has had breast cancer, that's a greater risk that you would have breast cancer. Race. More white women than African American women have developed breast cancer. And alcohol use. Studies suggest that the more alcohol you drink, the greater risk of developing breast cancer you have. Your doctor will check for breast cancer before, your doctor can check for breast cancer before you have any symptoms or signs. During an office visit, your doctor will ask you personal questions and your family questions to develop if you have any risk factors for breast cancer. Your doctor recommends that women and men have regular clinic breast exams as well as mammograms to find breast cancer early. And treatment is more likely to work when the breast cancer has been detected early. My little poster here, and then if you guys come up afterwards, there's a little picture of what a little tumor looks like in the breast, which is cancer. So that's over there, and then there's my poster. I did this because I've had family members and friends that have breast cancer, so I thought it would be a cool way to show you guys that men and women can have breast cancer, and definitely go get it checked. It's nothing to joke around about. Like I said, the earlier it's diagnosed and can be treated, the better your risk of overcoming it can be. That's it. Thanks, guys. Is there any questions? No questions? Yes.
Do you recommend that you have your personal doctor examine you at least once a year?
Yeah. It's the internet said that every 2 years is recommended but if you if you have family members in the past that have breast cancer, I would do it whenever you feel comfortable with. If you want to do it every year, go right ahead. Okay.
Thank you. Thank you. Very good.